Hi guys, welcome back to Mindful Mondays.
Another episode.
Yeah. Woo! I tell you what, I've got a wish.
Oh.
I might see if my genie will work today. Do you want to rub with me?
I'll rub. Yeah. What do you wish for?
I wish I could speak to a sports therapist.
Actually, same.
Yeah.
Oh my gosh. Do you feel something happening?
Ooh, it's Hannah. Oh my god, Hannah, our sports therapist.
Hi, hello. Thanks for having me.
You're welcome. So, we're going to ask her some questions today.
Yeah, we're going to get to know Hannah.
And what you do.
Yes.
Yeah.
Okay,
Exactly.
I'll
That's good.
Hattie kickstart with question number one.
We can do the first question. So for anyone who's never been to a sports therapist before, what do you actually do?
So, it can vary. We get confused sometimes, or people get confused with physiotherapists and sports therapists.
Mm-hmm.
We're quite similar. We do different modalities, but more my part is the rehab side and injury sort of prevention, and then also diagnosing and rehabbing.
Perfect. Next one.
Cool. Right, well, next question. What is the difference between sports therapy, physiotherapy, and chiropractic care?
There you go. I'll give you the microphone.
Thank you. Share the love.
So, as I said, physiotherapy and sports therapy is quite similar. Going off like uni sort of vibes, we do different courses, a little bit different, but sort of as a whole sort of packed and then it comes together. We're quite similar in our ways. Then sort of more scientific, we're sort of more physical and want to get to know the injury more than delving in a little bit deeper with the injury. And then chiropractic is obviously where it differs a little bit. Obviously yourselves and the guys here focus a lot more on the spine and the vertebrae. And then that's where I come in to help with the rehab and rehabbing the patients on that side as well.
And that you do well.
Yeah.
Right, next one.
Next question. Okay, so this one kind of links to the second one. So how does Whoa, let me just reset.
Suffer.
My nervous system reset.
Yeah.
How does sports therapy help alongside chiropractic? Oh, okay.
There we go.
So here we do it, I think we do it pretty well. So the patients see the chiropractor for the first sort of 3 weeks, and then they come and see me we build on their strength and their core work, which is where most of the time it's relatively weak. So I come in and we can do lots of different exercises to help build the core. It might not just be necessarily the core structure. We can help with upper limb, lower limb rehab and gaining the strength within that area as well.
Perfect, really good.
Well done, you. Very impressive.
Okay.
Isn't it?
You're
Both
next.
are.
Yeah.
You both are. Anyway.
Oh, thank you.
Why do some injuries keep coming back after treatment? Because I feel like that's quite a big one. Because I think people probably think, oh, I should be fixed now.
Go back straight to
But it's not.
Yeah.
It's back.
So
Sorry.
it differs in rehab and what the injury is, of course, and it also from the patient's point of view, how much they want to recover as well. Unfortunately, sometimes injuries aren't too much of a quick fix, so it's about persevering. Also understanding the injury itself. Sometimes the condition might not be what the injury is, so it's sort of about working alongside. Sometimes you might get a little bit of a regression before we get a progression with the injury, but once we get towards the more progressive side, then we know we're all on the right track. So sometimes you can't recover straight away, but it's about finding out what is actually going on and working from there.
Well done. Big words in that one. That's the biggest words we've used.
Regression and progression.
Swallow the dictionary.
It's really educational.
Yeah.
I feel like this is the most educational one we've done.
This was under educational questions.
It is. Okay.
So,
that was the last one for that one. So, next section. Is rest always the answer when you're injured?
Oh.
Which one do you want?
who are you
Who's my
picking?
favourite?
Who are you
Who's my
picking?
favourite?
Oh! I'm doing myself about the
I'll take
equation.
this one.
Yeah. I'll let you take Hattie.
Here you go. You can have
Thanks for
mine.
saying that. You have to repeat the
Oh.
question. So we got me off track.
Was this one?
Yes.
Is rest always the answer when you're injured?
Initially, sometimes yes. You might need the body to recover, sort of in the inflammation stage, like the early stage of the injury. But that doesn't always mean, you know, we have to sit around and rest. It's more sort of the early sides of the injury. So really simple exercise rehab you usually start with, and then we can work from there to more intense rehab, sort of middle and late stage. But yeah, you don't always need to rest. Sometimes 48 hours period post injury is vital, but working from the 48 hours onwards is the most beneficial to start the rehab process.
Keep moving.
Yeah.
I'm not random dancing. Keep moving.
Keep moving.
Keep moving. Right, okay. So, can stress and lifestyle affect physical pain?
Definitely, and I think here as well we've got a really good modality, which is the CLA scan.
Yes,
which can come into play quite a bit, so we can see how much stress goes through the spine with the patients, which is really beneficial, and it gives a good insight into how much stress a patient is going through, which is good. But yeah, I think in general life, especially when it comes to more chiropractic care as well, within sort of the spine itself, stress can play a big part in the pain and any sort of muscular aches as well, potentially. But yeah, definitely, you know, throughout the spine, that carries a lot of stress. So if you are stressed, then yeah, it takes a toll on your body for sure.
Don't be stressed.
Yeah, that's definitely true, isn't it?
Yeah.
You feel it up here, don't you? When you stress your upper traps and you're just like, locked up there. We see that a lot.
Do we have an episode on that? I can't remember if we've definitely spoken about that before.
I think we spoke like desk workers, because they tend to
for
just
4 and breathe out.
That was on Nether's recent.
So our last one.
Our last one.
Yes, that's what I was thinking about.
Yeah, we said to like think about how you feel, drop your shoulders.
Yeah, how you can
loosen
stress.
Yeah, there we go, doing our
Loosened
jiggle.
up.
Okay, so next question: how important is mobility as we get older? Because that's
Yeah, I think this is vital, and I've seen a lot of patients here as well. A lot of them go to the gym, which is amazing. They're keeping active, which is super important. Obviously, a lot of elderly patients, not necessarily elderly, but older patients and people in general can have signs of arthritis and arthritic joints. So unfortunately, that's not the best condition. So working to help build any strength and the mobility side of things as well, keeping active, keeping walking, coming here, you know, is super important. And like the gym.
Sorry. Don't throw you off.
No, you're right. And like if you can go to the gym, then definitely try that out, even if it's just once a week. It's just keeping active as well. And I think weight is important as well as you get older. You know, perhaps more the weight you put on, the more stress and the weight goes through the body and the bones and the muscular side of things. So yeah, keeping that side of things ticking over is good as well.
We do have a DEXA scan as well.
Yeah, we've got a DEXA scan, so that scans the density of your bones. So a bit with like mobility as well, like going to the gym and doing kind of that kind of impact sport as well is really good at just keeping your bone density great, because as we get older, even mostly women, but men as well, tend to lose density in their bones, and then that causes more likely to get fractures. So definitely with moving, keep up the impact. But yeah, our DEXA scan is here, to check that.
Yeah, check that out. Okay, right. Next one. How long does recovery really take, and why does it vary so much?
So it can vary due to the injury. Say for example you have an ACL injury, which is one of the ligaments in your knee. That can be a prolonged injury, and you most likely need to have surgery for that. So hence why that's a long-winded injury. Sometimes like a hamstring injury, even like a minute one, can take a little while. It depends what's going on around the muscular joints as well. It doesn't necessarily mean that just the hamstring is injured. It might mean other sort of areas are injured as well. So it's making sure that, you know, we're fully professional in making sure that everywhere is rehabbed, and we're not just targeting the hamstring, even though that is injured, but making sure everywhere else is strong enough to continue with their sport or what have you.
Have you ever been injured?
I have, yeah.
What did you injure? What did you injure?
I've done loads of things. My hamstring, my quads.
Wow.
My knee.
Been a busy girl.
Yeah. That's
busy
what
girl.
In sports, but
that's why I don't do it.
It's fun.
keep my ACLs intact.
Yeah.
Yep.
There you go.
Right. Now what?
Oh, so now we're going to go on to a bit more fun and light-hearted questions to get to know Hannah deeply.
We're gonna get to know you.
We are.
Yeah.
We're going to get to know you. So, what is the most common myth about sports therapy? Like, what is a myth? What is a myth?
I think some people make up, isn't it?
Yeah, like it's
Like an
like
idea.
fake news.
Yeah,
Yeah.
fake news. There you go. Sorry about that.
I would say people think that we haven't got, like, so sports therapy versus physiotherapy, people see physiotherapy as like a stronger sort of, I don't know, qualification, let's say, whereas, as I mentioned before in this, that we do similar courses at uni, so we do focus on a lot of the same things. It might differ slightly, but yeah, I think the myth is sort of, people think physiotherapy over sports therapy, which I kind of understand, but yeah, there is a big myth around that area of expertise as well. So yeah, I think for me the biggest myth is that sort of physiotherapy over sports therapy.
I think it's a bit in the name as well, isn't it? Like sports therapy, people just think, oh, you have to be really, really sporty.
I just think football, rugby.
Yeah, exactly. Like physiotherapy, people think, oh, it's for everyone. So it kind of is that,
The psychological, if I don't play sports, I need to go see a physiotherapist.
Where it's not, true. Anyone can come see.
Yeah, exactly. You don't have to play a sport.
And you don't have to call on your genie.
Yeah.
To get into a bit. Right. Next one. If you could ban one gym exercise forever, what would it be? I'd ban the whole gym. I'm joking.
No gyms.
Yeah, exactly.
Yeah.
No gyms.
That's a tough one. I think maybe RDLs.
Ooh.
That's
They're a good
that's what
one.
we said.
Yeah.
We had to talk about this earlier. Wow.
Yeah. Not for too many reasons. I just think if you don't get the form correct, you could be in big trouble.
Yeah.
So, you know, seems like a few people in the gym are thinking, oh, their form's off. Wouldn't ever say anything to them because they wouldn't want to.
I'm Hannah.
Yeah.
Wrong. You're gonna hurt yourself.
Yeah. I think if they don't have the education around those sort of exercises and they're just doing it off the cuff, then sometimes it can be a little bit
definitely
dangerous because it does take a toll on the body, and especially if you're using a lot of weights as well
on the lower back.
Yes,
People
You're gonna hurt your back.
Too heavy too soon. And then
definitely. So I'd probably say definitely.
We all agree on that.
Yeah,
Wow.
all agree.
Yeah. Yeah.
Clap with me. Okay,
Hey.
hit it off.
So what injury makes you wince the most?
Without a doubt, ACL injuries. I think.
Interesting.
Yeah, I think from also playing football myself, a lot of women in sport, not just in football but in sport, suffer from ACL injuries. So when it happens, it's just like, oh, it's happened again.
Have you seen it happen?
I've seen a few happen on TV as well.
Is it like going in for a tackle and then like, oh?
Sometimes it's most of the time the evidence has shown it's non-contact. So it's just a difference, change in sort of direction. Of the knee.
And then
it
goes.
And like a lot has happened on AstroTurf, which is like sort of fake grass. So that hasn't got very good evidence for stability in knees. So yeah, I think
you can't really dig into AstroTurf, can you? I guess you've got the little spikes on the boots.
On actual grass you can
cling on.
It's got that grip.
So I think from playing football.
I think anything with knees just freak me out.
Yeah.
We said
Achilles. An Achilles rupture.
Yeah.
That's
a bad one.
No.
That makes me feel physically sick.
It's not nice.
Have you seen that?
I've seen the videos with that person. Yeah.
Okay.
So,
what's the worst thing you've seen in real life?
Probably a tibia fracture of the knee.
Ooh. Did it come out?
Yeah. It was slightly poking out. It wasn't an open fracture, but it was
you can
near
just
enough.
see it.
Yeah, it was near enough there. So.
That's not nice.
Can't do that.
That was a tough one.
Yeah. How about you, Eleanor? What's the worst injury you've seen?
I broke my brother's finger once. I broke my pinky playing netball, and it literally it was just going like multicoloured, and it went really fat. That was in primary.
Okay.
But I got through it. And then my brother, I think he might have broken something. To be
Okay.
honest, I haven't really seen too much.
Mm.
I don't really like stuff like that, so I try and steer clear. I'm very careful.
Mm.
Touch wood.
Mm.
Yeah.
What about you? You're horsey, so you will definitely see some
Well,
stuff.
It's a weird one. I've seen someone fall off the horse and then the horse has literally stood on her head like studs in. So like studs on a stud boot.
Yeah.
Like and
Oh,
she had
God.
like yeah.
Oh.
That's just a really
Can
that's
I
just a
concave
wild.
it?
Done a good job there.
No, because I think the horse didn't put the whole pressure.
Right,
Because
we
horses
do.
are pretty good. They know when you're under them, so it kind of like
Like, ooh.
yeah.
Yeah.
So
Like
it just like
showing your
stud
dog's
literally
foot.
went on her head.
You
but
know,
like,
yeah.
But I haven't actually seen many considering her ride.
That's quite surprising.
Yeah.
I would have thought you'd seen a few.
Yeah, just me. Just
Yeah.
things that happened to me. Not many. I'm actually quite lucky.
You had like a broken. What was it?
I broke my arm. But
That was it, and then you
Hardly.
went about her day like normal, driving and whatnot.
Just
She was like, "Oh,
ignored
this is
it.
a little bit sore," and then the next
Yeah.
day you went to the
Yeah.
hospital. And they're like, "Yeah, it's
yeah.
broken."
Yeah.
Fair play though.
Still.
We're just
Yeah.
tough
It
girls.
is.
Yeah.
I'm not, but
You are. You broke your little pinky in
I did.
Yeah.
primary, so you go tough girly there.
Got through it.
Yeah.
Yeah.
Made it on the other end. Right.
Okay.
Is it my turn?
Your turn.
Okay. If you weren't a sports therapist, what would you be? Hattie and I have already
We've
answered
answered
this.
yeah.
Okay.
Hopefully
What
saw
for
that
me, or you've
episode.
answered it for yourself?
For
For
ourselves
us.
in.
Fantastic to know.
Did you not watch the
Did
podcast?
you not see our
I
podcast?
missed that one.
What you were gonna?
I want to be a conservationist. I
Yeah.
love,
Yeah.
And I wanted to own my own like kennels.
Yeah.
Yes. Okay,
Yeah.
I didn't know that.
Right, you'll
Yeah.
go.
You probably won't even see this coming, but I used to always want to be cabin crew.
Really?
Yeah.
Oh, wow. No way.
Yeah, so
I thought I could picture
nice,
you doing
yeah.
that. Yeah.
I
Did
don't
you
know
make
why.
Smiley?
Thanks.
That's
yeah.
okay. I can imagine that.
Yeah, I don't know why. I think a bit weird. Sort of. I love like aviation side of things.
Yeah.
I think that's cool. So yeah, I always wanted to be
Flying.
cabin crew and just I suppose travel the world. But here I am as a sports therapist.
There you
so
go.
that's okay. Also.
Travelling around Broughton.
Yeah.
Travel. I wanted to be a marine biologist as well at one point.
That would be quite cool.
Yeah.
Yeah.
So I thought like live in Hawaii.
Go into the sea.
Yeah, like you know.
No, that would freak me out. I don't like the sea.
That's the thing. Like now
don't
I
like
actually
the
see
animals,
like
yeah.
sharks and stuff. They freak me out.
Yeah.
Yeah.
Not happening.
No.
Jellyfish come along to sting you. Right.
Okay.
Quick fire
Ooh,
questions.
okay.
You're not allowed to see
Quick
this.
thinking here.
Right.
Okay.
Go high.
Okay. Foam roller or massage gun?
Foam roller.
Well done.
Mobility or strength?
Strength.
Ooh, see.
50-50.
Oh.
I'd want to say
I would say
both.
mobility, but
But
I
I'd say
agree
both.
both. But
Yeah.
Can't say both.
it's hard.
Yeah.
That was a hard one.
Yeah.
That is a hard one. Right.
Early morning workouts or an evening session?
Oh. I would love to say early morning workouts. So I'm going to say early morning workouts.
Good for you.
Okay, well
I could say
done.
I do the same, but I think, that's
Okay.
to get
Yeah.
started for the day.
Mhm.
Yeah.
Right. If listeners remember one thing from this episode, what should it be?
To keep moving, stay active,
Mhm.
look after yourself, and I think those are
The main things.
Mhm.
big things. Yeah.
Cool.
Good.
Yeah.
Well,
That's kind of our message for all of them. All of
I was
us.
going to say, we kind of
We just
say that for
always
everything.
keep moving, guys.
keep moving.
But it's good that we all are on the same page.
Yeah.
Yeah, exactly. It's like a good motto to have.
Yeah,
Yeah.
definitely. Look after yourself.
Yeah.
Mhm.
It's been nice having you on
Thank
here.
you so much. Thanks
it's
for having
been-
me.
Yeah.
Treat you guys to having a new face.
Yeah.
Having our faces. And it's been a
Exactly.
longer one.
Yeah,
Probably-
look at
A bit more educational.
that. Yeah, a little bit more
Yeah.
than what we do.
Than what we normally do.
Okay.
But no, at least you had
Perfect.
fun.
All
Yeah,
good. If
lots
you
of
do
fun.
want another special guest, comment below who you want.
Yeah. But you have to give us time to.
Yeah, get them
Do
to
it.
come on.
Yeah, exactly. Bear with us. But
Yeah.
Yeah.
Okay.
Okay, cool. Well, that was Hannah. If you want to book in, feel free to contact us.
Yeah, give us a
You don't
call.
necessarily have to be a patient here.
No, exactly.
You can just call us and
Yeah,
book
you-
in with her.
Injured yourself, you know where to come.
Need a massage? You know where to go.
Absolutely.
Yeah.
Yeah.
Perfect.
Hannah.
Hannah. Like, go back.
Yeah. Ooh, she's gone.
Okay.
Okay, well, bye.
Bye.